So hi everyone, we'll be learning about Erbs and Klumpkes paralysis today. If you're watching this before your exam and you're skipping this video, then you'll have Bell's palsy tomorrow in your exam. What is Bell's palsy? This is your Bell's palsy. Tomorrow you'll have this face in the exam. So don't skip it, please watch it completely. So this Bell's palsy, forget this, we'll see this in your head and neck, okay? So as you've seen, this is your brachial plexus. If you didn't watch the video, the link is given. Go watch the brachial plexus first. So you have seen the Erbs point in brachial plexus. So the meeting point of 6 nerves is called Erbs point. So there's C5, C6 root. Any damage in this will cause your Erbs paralysis. That's it. The cause of this injury: excess stretch between the neck and the shoulder. Basically, you see this, the angle between the head and shoulder. If this is increased, then there is upper plexus injury. When this happens, if there is a fall from height and landing on the shoulder where it goes down and the head goes this way, there is injury. And during delivery, pulling the head and neck, so the increase. So this is the cause of Erbs paralysis. So as you can see in the simplified notes, the root value is C5, C6, and you can see why the deformity happens. You see, this is the deformity. As you can see, this is the deformity. Why this happens? We'll see this here. The muscles that lift the arm and rotate it outward are paralyzed. Which lift the arm and rotate it outward is paralyzed. That is C5, C6. It's gone, upper root, right? The muscles that pull the arm down and turn it inward are still working. That is C7, C8 is still working. It is functioning. So what happens here? The stronger muscles pull the arm in their direction, that is forming your vagus or policeman's receiving tip. The muscles which are strong, the strong muscles are which pull the arm down and turn it inward are strong. That's why this deformity takes place. This is the deformity happening. Vagus or policeman's tip receiving deformity. This is how the deformity is taking place. The muscles which are affected in the deformity is given here: deltoid, supraspinatus, infraspinatus, all that. Remember, don't break your head, because all this have a common root value C5, C6. Since it's injured, so all these muscles are paralyzed and you have this deformity here given again. So clinical position, wait a step. So what is the clinical position? Arm adducted. So first, what is adducted and all that? Here it's given, as you can see. So you see here, adduction is outward, abduction is outward, away from the body. Adduction is inward towards the body. Flexion, this is for the shoulder joint. So medial is towards the body, lateral is away from the body. This is all basic you have to know. And flexion is like this. Extension is making it straight. So these are the positions. Go through the positions once. So then, so this is how arm adducted. So basically, arm adducted, arm turned inward, medially rotated, inward rotation. Elbow is extended, and forearm turned inward, so pronated. This is pronation, this is supination. So that's all. You have seen the cause, and that's the summary. So this is this thing. So this is the deformity, remember. So you're done with your Erbs paralysis. Coming to Klumpkes paralysis, this is the lower plexus injury. Erbs paralysis, upper plexus injury. This is lower plexus injury. Involves the root of C8 and T1. Sometimes C7 also. Cause how? Hyper abduction. Abduction is away from the body, basically lifting like this. Hyper abduction will cause this. As you can see in the picture, there is hyper adduction, and here also there is hyper adduction. Increase in the angle. So, and sudden pull of the arm or during delivery, arm pull during delivery. These are the causes for Klumpkes paralysis. So again, in the simplified notes, C8 and T1 are affected. Why this deformity takes place? C1 and T1 are affected, and these muscles supply your hand muscles. Since your hand muscles are damaged and they're paralyzed, the fingers cannot be flexed nor extended, so forming a claw hand deformity. So that's very simple. As you can see, muscles paralyzed are lumbricals, interossei, thenar, and hypothenar. This is thenar muscles. This is hypothenar. So keep that in mind. And lumbricals and interossei. Interossei is between your bones. Interossei, ossei means bones. So these are the muscles that are affected. That's why there is a claw hand deformity. And other muscles affected is FDP and FPL. So if these are also damaged, the clawing worsens. And clinical features: claw of all the fingers due to the paralysis of the hand muscles, and loss of grip strength. The grip is lost, you are not using it. and loss of fine movements, because your hands are required for fine movements for suturing or art and craft or whatever. Since it has many fine movements, that's all lost in this paralysis. And then sensory loss of medial forearm. The cause you have seen: sudden pull out of arm, or hanging or catching up or pulling the arm during delivery. So all this causes your Klumpke's paralysis. So now with Klumpke's paralysis, there's one more syndrome known as Horner syndrome. Happens when T1 is affected. Basically, your lower plexus injury itself happens when T1 is affected. It has a triad. Remember, ptosis, meiosis, and hydrosis. Ptosis is drooping of your eyelid, and meiosis is basically a small pupil dilation is not there. It's no dilation, and hydrosis is no sweating on the face where it's affected. So why it happens, it's given. Other features are also given. So that's it on Erbs and Klumpke's paralysis. This is your clinical case study. The question is given here. Try answering the questions and please answer in the comments. And that's all done with the topic. Thank you.